We are live.
Hello, everyone. Good morning. Hope you guys are doing well. Today, we're going to be talking about digestive health with no stranger to the Healthy Way vibes. We've got Dr. Theresa, who's going to be talking about digestive health. I'm Fatima.
I am John. And so, yeah, she's no stranger to our show. And so just want to give a little bit of background on Dr. Theresa. She's a certified functional medicine chiropractic physician with a life purpose to help solve for patients' health issues through balancing their biochemistry with natural compounds using herbs, vitamins, minerals, neurotransmitters. She uses bioidentical hormones, chelators, binders, phytonutrients, and many more. So you can see that she uses many different modes to help her patients. She focuses on advanced testing procedures and extensive health history to create an effective treatment plan for her patients. And prior to this, she was a research scientist at a pharmaceutical company dealing with her own past. She had significant health challenges that only improved through natural means. She's a mom of two beautiful young ladies, owner and director of Health Up Institute since 2011, an active lecturer, educator on many health topics, and an international speaker on iodine therapy and its vital role in our health and healing. Besides her chiropractic doctorate degree, she has a Bachelor of Science in Chemistry and a Master's of Science in Environmental and Industrial Health from the University of Michigan. She's also a lifelong learner with an open mind of combining science with energy medicine, as she's also been trained as a Reiki master teacher and a yoga instructor. So let's bring on Dr. Theresa and start the show.
Hello.
Okay, I'm coming on. Just one moment.
Hello, Dr. Theresa. Thank you for coming on.
We're good.
All right.
Digestive health.
Tell us about it.
All right. Well, as you guys know, digestive health impacts everyone on a daily basis. Hopefully you're experiencing good digestive health and you don't even notice what's going on. But the majority of people experience mild to some pretty severe symptoms. Mm-hmm. So digestive health symptoms of things that aren't just as good as they should be. On the mild end, just burping a lot, bloating, a lot of gas. Those are mild symptoms, but they're not good signs. But then we get into some pretty more major issues that start indicating a bigger problem. Like when we start having heartburn, and you start getting it recurrently, we shouldn't be having any heartburn. And eventually you may get diagnosed with GERD, gastroesophageal reflux disease. If you start having really cramping, painful movements in your abdomen, and then you can be moving toward what's called an irritable bowel syndrome. And that can vary from person to person. It can be, loose stools, diarrhea to constipation. And we're going to talk about each of these things that I'm kind of bringing up that are different disorders, how to more deal with them naturally, but also the appropriateness of getting diagnosed with what's going on with you. But if you're, experiencing that cramping and painful situation with irregular bowels and it gets really bad, you may have to get some medical tests done because you might have something called Crohn's disease or ulcerative colitis, which is a bit more serious. You could, on the far end of the spectrum of most serious is colon cancer. And we're not going to go into too much detail about colon cancer because there really aren't any symptoms of colon cancer until it spreads, which is pretty scary. And it's usually you have more pain in your liver. And we're going to talk about liver health, but it's just screening for colon cancer. If it's in your family, get a colonoscopy earlier, see your doctor, and anybody over 50 really should get some screenings. There's different screenings because that's the way you're going to detect, hopefully in the early stages and start treating it from many standpoints. Kind of what we're going to talk about in correcting digestive health issues are also things that need to be done on the path of healing from a colon cancer as well. But moving back into some less as serious, but still serious, you can have things like diverticulosis, which are little pockets in your colon that can get infected from viruses, from a weakened immune system. They say food can get trapped in there and stuff, and then you get diverticulitis, which can be very painful. And like diverticulitis and ulcerative colitis, most people get a lot of pain more in that lower left quadrant of their abdomen versus all throughout. And if it's all throughout, it's more like a Crohn's disease.
Mhm.
So that, I mean, there's smaller things like hemorrhoids is an indication of a digestive issue. People never want to say the word anal fissures, but that's serious because it's blood. You see blood and it's very scary to people, and you want to know why. And there's reasons to heal it. So I want to really stress those differences between irritable bowel syndrome, which a lot of people suffer from, like 10 to 15% of United States citizens suffer from it, but up to 23% worldwide, versus an irritable bowel disease. So a syndrome is generally a grouping of symptoms. And that syndrome, irritable bowels can be linked, and it's clearly linked to both mechanical issues potentially in your gut, which can be modified by diet, the choices of your foods, timing of your foods, the amount of your foods, but it's highly linked to your stress, to the mind, to anxiety and depression. And the irony is, I know we're going to bring up, and you guys will probably have some questions. We'll talk a little about gut microbiome, how that's linked, but the syndrome is something that it affects women 2 to 3 times more than men. And the only way medically, if you just have diarrhea and a constipation alternating with nothing else going on, the good thing, it's not linked to higher colon cancer risk, so that's good. But there's no medications they give you for that, and which really seek natural care and alternative care. They just manage it with diet and decreasing your stress. But if you get some tests done, because of, it's like your pain for Crohn's disease or ulcerative colitis is high. It's like, whoo, 8, 9 out of 10. You are going to the doctor for this. Then they give you, there's a lot of medications that they give you, and some people will be on them lifelong, but that's not necessary always. There's a lot of things you can do to heal your gut in finding the root cause to let those tissues heal.
Right.
So what are some things that you can heal and do to properly or naturally, heal your gut? And is leaky gut part of that?
Yes, leaky gut is actually can be monitored. People, it for a long time, you would say leaky gut, and that was kind of on the fringe of people making up a word, and it's, that's what they thought for a while. And then there's more and more data and evidence proving there's a protein that can be monitored called zonulin, and also something called LPS, lipopolysaccharides, which should only stay in our gut. But when your gut is so inflamed, and they're supposed to be really tight junctions, but then they get a little bit open, then the lipopolysaccharides release out, and you can check that in the blood, and it's highly linked to a lot of problems and even cancer. And then also a protein called zonulin, which should not be around, and they can find that, and it goes back to the leaky gut. Having a leaky gut can make all other digestive problems worse. So often they go hand in hand. If someone has a diagnosis of irritable bowel syndrome, most likely they have leaky gut issues. If they have ulcerative colitis, they have leaky gut issues. If they have Crohn's disease, they have leaky gut issues. If they even have upper, more the stomach, the GERD, you think, oh, well, that might not include my intestines. It's all connected, because your digestive system is from your mouth to the back end, and it's one hollow tube. It's literally the outside world from what we eat to when it comes out versus the inside world. It literally protects it. It's like, if you want to call yourself a donut, we are a donut around our digestive tract. It's kind of crazy. And it's all connected. There's a problem anywhere, even starting from the mouth and the enzymes into the stomach not working well with the amount of hydrochloric acid, or there's gastrin and other biochemical reactions, all the way to the liver and the pancreas. It will create a lot of these problems.
Mm-hmm.
So I'm getting a little bit off track, but it's to explain how they're kind of all linked together. The fact that the digestive system has its own sensory system for changing things biochemically, mechanically, all types of receptors, and it gets affected by the health of our liver and even the health of our pancreas. And so all these things have to be taken into account.
So it seems like, I mean, like you nailed it. Like most people don't feel anything until they feel something, and then at that point, they're grasping for anything to cure or to heal themselves. But what if you don't get to that point where you don't feel anything? It seems like you have to start early, right? To kind of create a really strong and really a good defensive system, right? So what would you say to someone like, here's how you start to take care of your entire diet? Is it food, or is it what would be like, okay, to start, what would
Well, a couple points there. The only digestive health disorder you don't feel, sadly, is colon cancer. So the most serious problem, you better, look into other stuff, because when you have symptoms, which is pain in your liver and then digestive problems, it's already stage 3 or 4.
Mm,
So that's the only one. You're going to have symptoms with all your other problems, but it can begin in childhood. Many children are constipated, and they shouldn't be. There's no reason to be constipated. And constipation can start causing other problems, including the bacteria that's supposed to be in our large intestine should not be going up into the small intestine through where it connects, the ileocecal valve, but it can start going back there. But your question of how does it begin? It actually begins, of course, with the mom, the mother, during pregnancy and her health, and the delivery of that child. There are now multiple studies and many more hospitals that are on top of things. When babies are born, they should be going through the vaginal canal, and they have shown that that's their first exposure to the correct microbiome, to the correct bacteria to get into their face. It sounds gross, through eyes and their mouth, and it creates again, multiple studies linking them to autoimmune conditions, higher likelihood of autism, higher likelihood of other health issues as they get older, because they didn't create that correct microbiome. Now you're like, okay, how do I start from the beginning stage of the gut? Okay, great. Hopefully the baby was born vaginally and breastfed, and not C-section. They took care of it, and breastfeeding too. Breastfeeding is another really key part. If you can't, you do your best. But then you've got to feed that microbiome, and that is with fiber and fermented foods. So even as when you start introducing foods to a baby, they need to have different soluble and insoluble fibers, vegetables. Think of that simple. You're not generally going to give a baby psyllium, but as an adult, we eat psyllium more. But when they get older, toddler stuff you can, and flaxseed meal. Start giving them probiotics when they're young, just because, and then having a child play outside. So we live in a very sterile world, and it's gotten even more sterile with COVID. And so these children being born right now wearing masks all the time, and that's a whole nother controversy. And of course, we should be washing our hands, but you got to be careful that if you're not exposed to viruses, because you're not in a sick environment, you should be in a healthy outdoor environment. Play with the trees and the grass and the sand and the beach and the rocks, and also then you get exposed to all these soil biotica that is good for your gut. So that's where it all begins, is getting our exposures, positive exposures from our environment, and then positive exposures from our food. And then, I don't know if you're going to ask this question next, what disrupts it?
right.
Well, there we go. One, like I talked about, if how they were born and things like that right in the beginning. But even if everything was perfect in the beginning, getting antibiotics. We need antibiotics in certain situations, but now with the research on it, just one dose of antibiotics sets you up for up to 25% increased risk of depression, because that's how much it wipes out your microbiome. And up to, if you have 2 to 5 courses of antibiotics, because your microbiome connected to your brain health, up to 56% more likelihood to have depression. And I have multiple patients that, and even myself, through my childhood, had antibiotics, ear infection, chest infection, coughing, bronchitis, everything. And not taking that time afterwards to take your probiotics and to eat fermented foods. Because, of course, as we know, antibiotics can be necessary. And of course, you're going to have to choose that when needed, but you have to repopulate the gut.
Right.
I mean, it's linked to anxiety, it's linked to autoimmune issues, all these things, because you're killing off that microbiome.
Right. Yeah,
So
I guess you need to repair. Basically, comes down to
you need to repair. And
so,
and
is it true that they say that 70% of our illnesses basically start in our gut, because that is like the center of everything?
I'm not sure of if 70% of illnesses start there, but you're absolutely right that 70% of our immune system is in our gut. So if our gut is not healthy, that's a huge, deficit within our ability to fight off infection, to fight off viruses or bacteria, or even the molds in our environment. So with 70% of our immune system being in there, it just can't even fight what's happening. And then on top of it, if you have leaky gut, that means things are passing from this alimentary canal into our bloodstream that shouldn't. And then it can get deposited elsewhere, like environmental toxins, heavy metals, pesticides, fertilizers, phthalates, things from our plastics, bisphenol A, all these things. And then it deposits. It could be the thyroid, it could be your skin, it could be in the brain, it could be in your joints, and you start getting autoimmune conditions from that as well. So yeah, the health of your gut is just absolutely critical in your immune system, as you're just mentioning, autoimmune issues. But then we're talking about the brain gut axis health.
So what would be the first thing someone can do? Like, it seems like it's prevention, because you don't want to feel something and then go see your doctor. So regular checkups, especially like you said, in your 40s and 50s especially, you should go get your regular checkups. But now, what are you recommending people, kind of whether they feel something or if there's a family history? What should you be also getting the doctor to check off in terms of like what markers in the blood?
So absolutely, if you don't have any symptoms whatsoever, and you're a fortunate child, teenager, 20s and 30s, you're probably doing just fine if you don't have any colon cancer in your history. Basic blood work that they usually run, which is your CBC, CMP, so they look at your white blood cell count. Then if you're looking for elevated white blood cells, that's the first thing. If you have any mild symptoms of inflammation, blood work that they would look at would be your sedimentation rate and your C-reactive protein. So when you are in your 40s, let's say you've been healthy, like you said, and no symptoms, it's always a good idea with your basic blood work to get C-reactive protein and sedimentation rate. They're inflammatory markers. You will get your CBC, so they'll see if your white blood cells are elevated. And if these markers are elevated, there's some type of inflammation going on in your body. And a huge part of whatever inflammation, whether it's joints or it's coming from your gut. So I'll just tell you right now, as we're talking about gut health, you're going to have to heal your gut. If any inflammatory marker is up and you have secondary symptoms, headaches all the time, so that's why you get your blood work done. Guess what? You're going to have to work on your gut health as well in order to stop those headaches. It's any inflammatory markers that are elevated. So that's without digestive symptoms, kind of as you're saying, no symptoms. When you start having any symptoms, which a lot of people do, again, simple, just bloated all the time is not normal, crampy, gassy, having alternating type of bowel movements, whether they're loose or you're constipated. There is stool tests that can be done to see what do you have, what's your type of bacteria in there, because you can see if there's a bunch of the bad guys, C. difficile and a bunch of bad guys, or Clostridia, or if you have enough and the right ratios of the good guys. It can look for yeast in there, which is not good, and fungus. Then it can look for other things we don't like to talk about, but parasites, roundworms, pinworms, and find we don't like that, but they're there and you need to get rid of them. So you want to see if those things are there. And then there's very important urine tests to check for organic acids. Organic acids are byproducts of metabolic processes in the body. And these processes are happening because of bacteria, because of the mitochondria, because of biochemical reactions. So when you look at these organic acids, it'll tell you again what are the good bacteria? What are they doing? Bad bacteria? Could you possibly have high mold in your body? You can see that from this test. You can see how your body is making neurotransmitters, which your gut is making, like as you point out for immune health. But 90% of your serotonin is made in your gut. And you need to have the appropriate diet, the right amount of tryptophan coming in to even make the serotonin. And then 50% of your dopamine is coming there. And you can see that from these urine tests. And the urine test can also look for toxins. So if you've got symptoms, and we are exposed to 700,000 toxins in our environment plus. There's an article that's like said we're exposed on a daily basis, which I hope that's not like that in my house on a daily basis. But those toxins, the urine test can look for environmental toxins as well as heavy metals. And if those are in your body, which they should not be, they are altering the biochemistry of your health. So if your body knows how to heal, which is fantastic. We cut ourselves, it heals up. If we cut ourselves or damage something inside our DNA, our cell membranes, the body knows what it needs to do. But if there's some heavy metal, boom, jamming itself into some spot, stopping it, or there's some toxins that are just kind of clouding up and making these reactions not happen, you're going to get sicker and sicker and potentially have something as severe as a DNA mutation, which would lead you toward that cancer route, which of course we absolutely don't want. So, and to recap that the tests you'll want, even when you're younger, you get your basic blood work. You don't really need those other tests unless you have symptoms. In your 40s, if you have colon cancer in your family, talk with your doctor. Most likely they're going to there's certain screenings. You can do some stool test screenings, maybe in your early 40s, but then you're going to want a colonoscopy probably. And then over 50, absolutely. But any symptoms are all those other tests. Look for the inflammatory markers in your blood, urine sample, and stool samples.
Okay. So to sort of continue with this conversation of the testing, but are there any tests that we ourselves can do at home? Like say the apple cider vinegar test. I know that one is like it's probably a tough test to swallow.
Tell me, what is your apple cider vinegar test?
First of all, I don't like apple cider vinegar at all, so I'm not even gonna take it. But there is a test with the apple cider vinegar for sure, and I know that basically will help let us know if we're acidic or basic, which also then helps with our digestion, right?
So I actually, whatever tests you're doing, I don't know. I don't do that test with my patients. But what I do recommend with apple cider vinegar in mild cases or people who get heartburn every once in a while, not like daily on fire. That's, there's things that can be done. There's so many herbs that can help with that and diet changes that needs to be discussed with your doctor to do. But just, you get that occasional heartburn or the big meal with apple cider vinegar. You have to dilute it in water. Do not take it straight because it's very acidic. It can burn your esophagus, which you generally don't feel until it gets to the bottom, and then it creates problems. But you can start with just a teaspoon in 2 ounces of water, and you can work your way up to 2 tablespoons in 2 ounces of water, maximum of 4 ounces. So a small to a large shot glass. And after you eat food, so you need some food in there, you take it, or you can also take it immediately after you're done eating. So if you're done eating, you're like, oh my gosh, I didn't take it. You can take it right away or even up to 10 minutes later. That's totally fine because that food's going to be sitting there for a while. But if you've got GERD or any type of reflux, heartburn, you don't want to take an empty stomach because we don't know if there's other stomach issues going on that's a pre-ulcer or an ulcer, and any acidity just burns it.
Wow.
That's a good question.
Wow. That's something that we've got apple cider vinegar. We're using it in cooking and things like that, but I've never heard of using it to kind of.
Guess what? It comes in a capsule.
Oh.
So I've actually had some of my patients. I have a wonderful lady who would have just horrible retching after eating. She doesn't have other GI issues, but would have retching, just kind of, and she would do the apple cider vinegar, but would complain of the burning. You can get, and I found apple cider vinegar in a capsule. So it's a powder. And you're like, well, how does that work? Well, guess what? Water will reconstitute it. But so you take the capsule, so there's no burning going down. And then you drink a little bit of water. And that fixed it.
Mm.
Yes, so you can get a powdered form of apple cider vinegar. So
And
that's
also
pretty awesome.
and also you don't get that taste because some people can't stand
Yeah, I
the
don't
smell
like the taste of
so.
it and all that kind of stuff
Fatima,
as well. But one thing I want to mention regarding digestive health, so we're talking about the importance, of course, of the microbiome and of the gut, but I really want to stress things people can do. One, the liver health is super, super important. And I'm not going to go into great detail, but the liver is making the bile, and the bile gets stored, by your gallbladder in order to release appropriate amounts to break down fat soluble nutrients. And if you don't have that bile releasing that amount, one, you're not going to get those fat soluble nutrients. But number two, the bile actually cleanses through your small intestines. And when people have liver issues, whether or not they've been diagnosed with gallstones or inflammation of their gallbladder, they can get small intestinal bacterial overgrowth, which is pretty nasty and hard. You can get rid of it, but it causes a lot of gas and bloating. But it's because of the liver health. So if you have digestive issues, avoid alcohol. If you're healthy, you can have some alcohol. And caffeine can irritate digestive issues even more so. Other things to do, there are special diets, and I would talk to your doctor, but you can look up the FODMAP diet, which is just a low carbohydrate diet, a paleo diet. Dr. Gundry's plant paradox diet are really good diets to follow, and they've been done wonders for digestive health. Exercise, many studies, at least you walk 10 minutes after you eat helps a lot, but walking 20, 30 minutes a day is tremendous. And then getting your sleep. You hear it with all these health disorders, getting your sleep, but the more study being done on the microbiome, and they're actually studying the bugs need to sleep. Isn't that funny? The good bugs, they need to sleep as well. So all that is related. And we talked briefly in the beginning about stress. Irritable bowel syndrome is the most prevalent lower digestive disorder. Stress is absolutely linked to it. That's one of the therapies, is controlling your stress, keeping a journal of your food, but seeking out how to control your stress, through exercise, maybe meditation, yoga, therapy, whatever is needed. But that is absolutely necessary. And then natural remedies. We talked about the apple cider vinegar, gas, bloating, irritation. Sip on some tea, peppermint, ginger, chamomile. Because there's no caffeine, you can substitute your water intake, which you should have about 100 ounces of water every day, so you could drink that tea. And then I want to mention L-glutamine. You can look up L-glutamine on your own too, but 10 to 15 grams a day. There are studies of it actually healing many aspects of Crohn's disease, ulcerative colitis, irritable bowel. And then I would work with a functional medicine doctor if you have any of these major symptoms.
Wow, that's quite informative. John, what do you think? I think my head is spinning with all this information.
Well, the good thing is we can watch the replay and catch all these things Dr. Theresa is talking about. So also I want to point out, that whatever we share here is just for information and just for entertainment, and also for you to check with your health professional, because what Dr. Theresa is recommending may not be, we just don't want you to just start using apple cider vinegar and things like that. So do check with your health professional and see what program or what kind of preventative measures or even some treatments that would be good for you, and of course get your testing done as well.
All right, so we are at the end, but before we do end, John, how is your
journaling?
No, not the journaling, because we added a new challenge.
Ooh.
Your health challenge. How's your health challenge, eating challenge coming along?
That is going better, and it actually coincides with what Dr. Theresa is talking about today, because you don't think about, like, when you go to your bathroom breaks, does it hurt? Is it diarrhea? How often do you go? What can make it less painful or more regular? And so I've been eating a lot more vegetables, which is good. A lot more fiber, or vegetables and fiber. Having more granola. Actually, we've been having more, what do you call that? Oatmeal in the morning. And then, people know I do a smoothie or a shake in the morning as well. But sometimes that, it can get kind of repetitive, right? And also if I notice that the next day it's a little bit runny, then I know maybe I'm having too much smoothie, too much vegetable. So I've been implementing more of that, and I've been trying to monitor how much sweets. So
Excellent.
That's what I've been trying it's hard, but then again, it's that moment with, I don't think about grabbing it. It's the point when you actually, before you put it in your mouth, like what am I looking at? Because sometimes you're at your desk and you're just stuffing stuff into your mouth. And next thing you know, you look down and the whole chocolate bar is gone.
Yeah.
Oh
know
yeah,
that
chocolate
feeling.
disappears quickly.
Yeah, I know that feeling all too well. For me, it's been quite interesting. So I don't know if you know that I was just recently diagnosed with celiac. So it's just been relearning how to eat, and it's not been helping because my sister's been cooking a lot of food with a lot of so I'm like all over the map.
Mhm.
So I'm eating as much as I can, what I like, as healthy as I can, but I'm inhaling the flour, which has caused havoc.
Right.
So that's just something that I'm adjusting to again. But the eating, I would say, is better, much, much better.
And Fatima, I'm so glad you brought that up because actually, I mean, there's a whole gamut of digestive diseases or disorders. I didn't mention them all, but celiac disease is very important to talk about. And that is one of the not pretty much one of the only, but genetic disorders. And even if people in your family have it and you don't have symptoms of it yet, it's a gene that can turn on and off, like all genes can turn on and off. So people can get diagnosed later in life because you're like, well, if I didn't get diagnosed as a child, I don't have it. And it can manifest in other ways prior to digestive symptoms showing up. So with you having that, your family, your sister who's cooking better be checked. And you're right, breathing it in, even breathing it in is toxic to you. So it can become a whole family event and it's very serious. And it has to be dealt with for the rest of your life. But there's wonderful food you can eat. You can do all kinds of wonderful things. It's just making those changes and making those adjustments. But I'm so glad you got diagnosed and figured it out. I've had a patient of mine whose husband literally got diagnosed months before he passed away, and he was in his 40s. He didn't have digestive symptoms. So that's why no doctor ever looked for it. But it already attacked his kidneys and some other organs. They were shutting down, and it was all because of gluten and gliadin. And yes, even though you might love your pastries, you can make all that stuff gluten-free and live a very happy life without it, but you have to know if you have it or not. So thank you so much for bringing that up, Fatima.
Yeah, it definitely has been a change, a lot of experimenting with flours that I will eat and touch, but it's been a lot of fun. So coming up tomorrow, we have Sue Ward. She's going to be talking about healthy foods on the go. And then we have Claire, John, what's your last name?
Meigenheimer.
Okay. I'm not going to try to pronounce. There we go. She's actually going to be, she was a diabetic and now she is a bodybuilder. So she's going to share her journey. Our healthy food challenge does still continue until the end of the month. And then we have Dr. Theresa back in July on the 20th, where we will be talking about fibromyalgia. So again, if you haven't followed, please follow, comment, and share. If you found this valuable, please share it to all of your viewers. We are the Healthy Way Vibes on all the platforms. Thank you for tuning in and have a wonderful day. Bye for now.
Thank you.
Bye.
Are we off?